The affirmative is Yunhan, Tiffany, and Amanda, and I, Christopher. Proposition: welfare recipients should be drug tested. Job owners make mandatory drug testing for the workers. Why should welfare work recipients be excluded from drug testing when they receive aid? Although not every welfare recipient is on drugs, there are still people that use them, and this is a problem. The change we propose is not nearly meant for fiscal savings or wasting, but awareness for drug users to improve choices and become responsible, improve the welfare system, and better satisfy the needs of the families. California welfare recipients, past, present, future, that receive food stamps, cash aid, and housing assistance should be drug tested. All forms of tests, but I am using drug kits, and that's the key terms. Problem: in a study, U.S. Department of Health and Services said, we found that there was a discoverable amount of abuse on illicit drugs among TANF and aid to families with dependent children program clients. Higher rates in the 10% range tend to include from past months' use of illicit drugs. The highest rate noted to date in any study, 37%, five included females recipients reporting having used any illicit drugs at least once per year. Another problem is that these people can continue to receive aid, but it's okay for small retailers and large retailers to even drug test, says Colorado State Representative Jerry Sonnenberg. As the numbers clearly show, the problem is that there are discovered amounts of people that abuse illicit drugs. The money that is meant to help families in need, in some cases, are being used to fuel drug addictions. At this time, the need to drug test is still controversial and debated about. But hopefully, this class will make a decision that drug testing is beneficial for people that are drug-free and helping awareness for drug users and allowing access to reapply. Another study of the U.S. Department of Health and Human Services found that most studies of TANF recipients and persons receiving other types of government assistance find rates of substance abuse that are somewhat higher than those of general population not on assistance, though not greatly a big difference. The Substance Abuse and Mental Health Services Administration, a 2002 analysis found that the past month of illicit drug use was reported 9.6% of persons aged 12 through 64 in families receiving government assistance. Mr. Romney stated in WXIA TV in Atlanta, people who are receiving welfare benefits, government benefits, we should make sure they are, meaning drug users, are not using these benefits to pay for their own drugs. What can be done differently? What the members of my group and I have proposed to create is a plan that eliminates the errors and mistakes found in some states, like Florida, Massachusetts, and Tennessee. Obviously, the trespassing of privacy is a controversial topic that we need to discuss, but the negatives will bring this up later. Well, we and 31 other states conclude, avoid and don't disturb the Fourth Amendment. The drug testing is simply a way to prove your eligibility for receiving aid and not to stigmatize nor permanently eliminate candidates or invade personal privacy. How will this change occur? There will be 8 annual drug tests. There will be 2 at random every 3 months. They can be months apart, weeks apart, or days apart. California will choose public and private clinics and hospitals for the location where the drug tests will occur. California will now supplement the cost of drug tests for TANF recipients. If the WR, which is welfare recipients, has insurance, the cost of drug tests is partially paid for, estimating around $25 for appointment and the drug test itself. If the WR does not have insurance, the common cost of a walk-in appointment is $35 to $50. The common drug test kit that I will be using costs around $25, according to Craig Medical Distribution Incorporated, which happens to sell their own kit that detects 8 different types of drugs. Since the state of California will not be hiring direct agencies for the testing, certified practitioners are held into oath and submit the papers directly to the Department of TANF. Welfare recipients will receive a phone call from a local clinic if they do not have insurance, and the WR that do have insurance will also receive a call from their family doctor. These WR, those that are currently receiving aid, will be given 3 days to attend a clinic and will fulfill the requirements receiving aid for food stamps, housing assistance, and cash. If they pass a test showing negative, they will be reimbursed for half of their paid amount of the test, which would be $24, half of it would be $12. The walk-in clinic would use the money to receive the remainder of the test, and the remaining of the money would be left over to be submitted into the clinic. If the welfare recipient comes out positive, they will not be allowed to receive aid. They will be given 6 months to rehabilitate themselves or correct their morals. The state of California will offer programs with rehabilitation, but none will be directly created to help their eligibility needs. Only existing rehab centers will help their needs. In 6 months, they can reapply and show their proof of rehabilitation or a letter of recommendation by their family members expressing the individual has changed their morals or their ways. Once they have reapplied, they follow the same rules as all welfare recipients, and so do drug felons. The advantages: how will California become better? There is false methods to cheat the urine cup test, and the hair method is too expensive. But with Rapid Check, which is $24, it is inexpensive and convenient for the welfare recipient and the practitioner. The Rapid Check multi-drug 12-panel screening test card reads: for approximately 95% of abused illicit and prescription drugs in one simple use, to use all inclusive devices. It works by applying urine, and that is by far an inexpensive alternative to the lab urine test. The benefits of using the Rapid Check is the speediness and convenient. This little device that checks 8 drugs can quickly determine the aid and loss of a welfare recipient. We are confident that the methods of 8 annual randomized tests will save money for the recipients, teach them about responsibilities to be drug-free at all times, and put a stronger priority on family. Though it is clear that we are trying to save millions and millions of dollars for California that is already buried under debt, we believe that the method of forgiveness and starting fresh is possible as well.